So breast density refers to the tissue composition in a woman's breast. There are three types of tissue in a breast. There is fatty tissue, there is glandular tissue, which is hormonally sensitive, and then there's fibrous tissue, which helps to hold it all together. Now on a mammogram, fatty tissue is gray and fibrous tissue and glandular tissue is white. And so the more fibroglandular tissue you have on a mammogram, the more dense your mammogram is. So breast density is important because for two reasons. One is that it is a risk factor for developing breast cancer, so that having denser breasts can slightly increase your risk for having breast cancer. And it's also important because it can influence the ability to detect a breast cancer on a mammogram. So there can be a little bit of a masking effect. The purpose of this law is not so much to increase the number of screening tests that are performed. It's really to encourage women to better understand their breast cancer risk, and we'd also really encourage risk assessment before making decisions about supplemental screening. So this new law requires that women who have dense breasts that are seen on mammogram be notified directly that they have dense breasts. So that is what's new. We radiologists, when we read mammograms, have routinely been categorizing and describing the amount of density in a woman's mammogram and also placing it in the report that goes to the doctors and other clinicians who order mammograms. So what is different is that now the communication will go not only to the doctors who are ordering the mammograms, but also to women directly. And the idea behind this law is that if a woman has more information about her body, ultimately she'll be able to make better health decisions. About half of women will have mammographically dense breasts, so it's very normal to have dense breasts and have it be seen on your mammogram. So having dense breasts alone doesn't mean the woman is at high risk for having breast cancer. So I think that is one of the most important things about the law, is that ultimately to make better decisions about your health, it's important to make an informed decision. So what we'd really like to encourage women to do is to talk with their doctors about not only breast density, but also other risk factors for developing breast cancer, such as a family history or a personal history of breast cancer. There are guidelines about women who are considered to be at high risk for developing breast cancer. Those women, it's recommended that they receive both mammography and MRI for breast cancer screening. And I think what we all agree on is that we want women to make good health decisions. We want them to know about their bodies. We want them to talk with their doctors. I think the harder thing becomes, when do we have enough evidence to really recommend additional screening? You know, which women should get additional screening beyond mammography, and which women will do well with mammography alone? Mammography is actually federally regulated. It's one of the few diagnostic tests that is federally regulated. And so not only do we issue a report to the referring clinicians, we're also required to send a letter to women with their results in what's called lay language, so non-medical terms that all women can understand. And so we are already doing that, facilities that are performing mammography. What is the change now is that these women need to be notified directly in this lay letter, and then actually our Washington state law has specific language that needs to be included. But an important and positive outcome of this law is if we have women who are truly at high risk of developing breast cancer and start a conversation with their doctor that really helps them become identified as women who are at high risk, and then they go on to have appropriate supplemental screening, I think that'd be a really positive outcome. Mammography saves lives. It really is the only breast cancer screening test that has been shown to reduce breast cancer mortality. So I do want to reassure women that it does work. The other thing I'd like to reassure women is that screening works for women who receive it. So it's important to keep coming back for your regular mammograms. But with this new law, I think it removes that potential financial barrier for women, and I think that's good news.